Good morning, friends, colleagues to Caracon 2025. I'm Janice Jones. I'm the CEO at Caracol, and I'm so glad to be kicking off this important morning with us, with all of you. It's just past morning into afternoon. So glad to see so many of you joining us on this Indigenous Peoples Day. Whether you're joining virtually today or through the remainder of this week through Thursday or planning to be with us in person on Friday in Cincinnati, where our keynote speaker, Jesse Milan Jr., CEO Emeritus of AIDS United, will share with us history and the future of this battle. Thank you for being part of this important conversation. Over the next few days, we'll explore the evolving landscape of HIV prevention, care, and advocacy, and how we can work together to keep our communities healthy and resilient. A special thank you to Adam Riley, Tricia Bath, and the entire Caracol staff and the Symposium committee for this tremendous work that went into organizing this week. Your creativity and commitment made this possible. Now, we're still getting together the final pieces on the slide, so please bear with us, but we will have a beautiful PowerPoint for you shortly. We're grateful, of course, to our sponsors and partners, Gilead Sciences, Maytech, ViiV Healthcare, Merck, and Hamilton County Public Health, along with our community partners, and to continue to show up for this work in tangible ways. HIV advocacy doesn't pause. Not during election years, not during funding debates, not through government shutdowns, not when political priorities seem to shift. This week is our time for reflection and collaboration and recommitment to the mission that unites us, to ending the HIV epidemic. With that, I'm honored to introduce our first speaker, Sean McCormick, staff attorney with Positive Justice Project at the Center for HIV Law and Policy. Sean's work bridges law, policy, and public health, centering justice for those most impacted by systemic barriers. Sean, thank you for being with us and helping us start this symposium week with purpose and inspiration. And so I believe we are getting to the point now, Chris, that the slideshow is ready to go. Again, welcome and thank you everyone for joining us.
Hello, everyone. Thank you for the introduction and really an honor to be here today. Again, my name is Sean McCormick, and today we'll be talking about trends in divestment and criminalization, connecting those ideas and understanding ways that we can fight back to protect the rights of people living with HIV and promote public health. At this point, I'll transition to this slide, which says, I'm Sean McCormick. I use he, him pronouns. I'm a staff attorney at the Center for HIV Law and Policy. Please feel free to contact me if there are any questions that come up within this presentation. For the Center for HIV Law and Policy, I'm going to just introduce our organization as well as the Positive Justice Project, which is our core project. CHLP is a multiracial organization that uses a Black feminist queer lens to analyze the issues of discrimination, criminalization, and oppression of people affected by HIV and other stigmatized health conditions. In 2025, CHLP is celebrating 20 years of making positive justice possible through legal advocacy, innovation, and unwavering commitment to HIV justice. From its inception, CHLP has worked in close partnership with HIV advocates and prioritized addressing the impact of HIV on LGBTQ+ folks and Black and Brown communities in particular. The Positive Justice Project is a core component of CHLP's work. PJP provides legal and policy technical support to about 15 state and local coalitions of people living with HIV, advocates, researchers, nonprofit leaders, government officials, and other key stakeholders. We are involved with the coalition in Ohio, the Ohio Health Modernization Movement, which has been introducing legislation to modernize the HIV criminalization statutes in the state. I want to focus on some of the guiding principles behind the Positive Justice Project. And these principles guide a lot of our work. Our overarching goal, of course, as an abolitionist organization, is to remove laws that stigmatize, marginalize, and oppress communities deeply impacted by HIV, especially Black, Brown, LGBTQ, and working class people. And we remain grounded in three core principles. First, laws that criminalize people's health conditions as well as rob them of bodily autonomy must be eliminated. The second principle really speaks to our process. Local folks living with HIV have the knowledge and experience to lead efforts to decrim HIV and other stigmatized health conditions. And within this principle, we emphasize our intersectional focus and our value in never leaving communities behind. So in the event that a coalition's goals or actions intentionally or unintentionally exclude or silence those most affected by criminalization, we will remain steadfast in advocating for their inclusion, and we will not be complicit in allowing their erasure. Third, criminalization has no place in public health. We must meet public health issues with public health solutions, effective public health solutions. All right, as just an overview for our today's presentation, we'll start by reviewing some of the most significant attacks on the health of people living with HIV. It seems like we're still having trouble with the screen. I think it has to do with, Adam, your screen is also shared at the same time. It's kind of difficult to read. While you're getting that sorted, just to provide an overview of today's presentation, we'll emphasize some of the significant events within the last 10-ish months that have deeply impacted people living with HIV and other communities disparately affected. We'll underscore the role of criminalization within the administration's onslaught. We'll then explore existing legal and policy structures that impose criminal penalties on people living with HIV by documenting the scope and harms of HIV crim within the country as well as in Ohio in particular. And I'll leave you with some examples of continued progress that we see throughout the country and emphasize key takeaways from that progress and the role for intersectional justice within this advocacy. And lastly, I'll leave some additional takeaways and answer any questions that folks have. So starting off with some of the most significant attacks, these administrative attacks have attempted to defund healthcare and other public health services, especially for Black, Brown, LGBTQ, and working class people. The administration has initially froze USAID and PEPFAR, which halted clinical and non-clinical services in international settings, disrupting medication disbursement, and just generally causing chaos. Modeling has shown that these cuts would lead to thousands of new diagnoses and greater prevalence of HIV disease as well as death. The administration has also moved to defund care for transgender and gender nonconforming people. The initial executive orders included one redefining gender and going against decades of research about gender affirming care as well as people who are transgender. It reflected this widespread coordinated attack that demonized and stigmatized people who are transgender, gender nonconforming, and intersex. They moved to implement the executive order through administrative rule, such as a proposed ACA rule from the spring that would bar the consideration of gender affirming care as an essential health benefit. That rule is still pending. The administration has also tried to impose its ideology on researchers by terminating NIH grants focused on meeting the needs of Black, Brown, and LGBTQ folks. Although many of those attempts have been halted through court orders, about $4.5 billion in funding for research remains interrupted by this administration's attacks. They've also gone after agencies by restructuring them and ridding them of career professionals who oversee vital activities. For example, we saw recent firing of NIH directors, as well as the entire body in charge of recommendations for vaccines, the Advisory Committee on Immunization Practices. And then the new folks that have come in have questioned decades of research on childhood vaccinations and using fake and discredited science. Recently, just on Friday, we saw the shutdown serve as pretext for additional firings at the Center for disease control and prevention. Over 1,300 employees have been initially fired, which really destabilizes our ability to monitor and respond to a variety of public health threats. Adam, it looks like we've skipped ahead a few on some slides. So ongoing, can we go to the second slide? Yes, ongoing attacks on health services. This slide really highlights the legislation that's been both enacted as well as proposed. The passage of the Big Ugly Bill will change many of the systems that affect health by modifying requirements for Medicaid, Medicare, the Children's Health Insurance Program, and Supplemental Nutrition Assistance Program, also called SNAP or food stamps. These changes would disproportionately target immigrants and would significantly restrict access to these programs. For example, part of the Medicaid changes that folks have maybe heard of are the creation of a requirement for 80 hours of work every month and regular verification or reporting about that requirement. And this creates, above all, a huge bureaucratic barrier to insurance access. So lots of reporting, lots of paperwork. There's also additional requirements and surveillance activities by Medicaid agencies, including increased reviews of eligibility and removed processes that were aimed at alleviating enrollment and participation barriers. Overall, the changes to Medicaid are estimated to increase the number of people who are uninsured by 10 million. The bill also failed to address the expiration of enhanced premium tax credits for the Affordable Care Act, which I'll talk a little bit more about later. And just to highlight another program within SNAP or food stamps, the law, the new law restricts exceptions to the work requirements and shifts many of the administrative and programmatic costs onto states, which really jeopardizes eligibility and benefits for participants across the country. Yeah. And at the same time, we know that the budget negotiations are ongoing, and that has created significant problems already. For example, telehealth services through Medicare, which have typically been included within the budget, have been unavailable and stopped, as well as certain at-home services for aging people have also been ceased. These budget debates have been going on for some time now. We saw over the summer a proposal that would have gutted HIV services, including one that included the entire defunding of the Ending the Epidemic initiative and a 20% cut in Ryan White services. This is all still in the air, and Democrats continue to push for a continuation of those ACA enhanced premium tax credits. These credits have reduced the premium payments for people who access insurance through the ACA marketplaces. And the expiration of these credits would cause significant problems for people living with HIV who disproportionately rely on marketplace plans. These insurance premiums would, specifically for these marketplace plans, they would skyrocket. And then in turn, many folks would be pushed off insurance. And with fewer people on plans, insurers would increase premiums even further. Their expiration would also shift many people to AIDS drug assistance programs operated by states through Ryan White legislation. These changes would destabilize AIDS drug assistance programs, or ADAPs, as they're currently designed, potentially provoking them to restrict eligibility, limit the services offered, or impose wait lists on coverage. Next slide, please. So at the same time of the defunding of care and restricting eligibility of benefits, the administration, as well as some state and local governments, have moved to criminalize certain aspects of care or the provision of care, especially care for trans and non-binary folks, as well as reproductive care. This is part of an overall trend towards increased criminalization in our country. For instance, following the end of Roe through Dobbs, many states moved to criminalize different aspects of abortion care. Recent data from Pregnancy Justice has showed that more than 400 people have been charged with pregnancy-related crimes in the last 3-ish years, with many of these prosecutions occurring in Alabama and Oklahoma and against working class folks. And care for transgender, non-binary, and intersex people have been a huge target, of course. The administration issued many executive orders aimed at restricting access to gender-affirming care for everyone, but especially for young folks. We've seen internal memos describing efforts to apply existing federal law to prosecute people who have provided surgical services to young people. The Supreme Court, in the Scarametti decision, additionally gave the green light to states to create additional laws to prevent children from accessing care by punishing providers who meet their medical needs. At the same time, we've also seen a recent escalation of the attacks on organizations that are providing services to communities who have been targeted by this administration, as well as holding the administration accountable and promoting democratic principles. Earlier this year, through executive order, the administration tried to ban specific law firms from government property, as well as bar them from contracting with government and revoke security clearances for them. These law firms have been heavily involved in challenging unlawful actions of the administration or supporting inclusive work environments. And more recently, an executive order has targeted nonprofits by depicting them as, quote, criminal or, quote, domestic terrorists, and urging federal law enforcement to surveil, categorize, harass, prosecute certain organizations, including Open Society Foundation, which was is an organization working to uphold human rights and democracy. On the next slide, I want to highlight some of the administration's actions to expand the scope of the criminal legal system as a way to, quote, address public health concerns. This trend is prevalent not only at the federal level, but also at the state and local level. Many governments have moved to use criminal legal solutions or tactics to address the overdose crisis as well as the housing crisis. Most notably, this administration issued an executive order in July that attacked evidence-based practices grounded in harm reduction and housing first, while uplifting and empowering carceral tactics like involuntary commitment or confinement, also called civil confinement, for people living with substance use disorders and mental health disorders, as well as experiencing houselessness. The order also called for expanded enforcement of existing criminal laws like loitering, camping, and drug laws as a way to address these really pervasive and systemic issues. And the administration, made these actions at the same time of the U.S. Supreme Court limiting the rights of people by granting state and local governments authority to criminalize folks based on their social or economic status. I have here one of the decisions in a case called Grants Pass, which looked at whether criminally punishing people who were unhoused and sleeping on the ground violated the Constitution. The court upheld the law, and that really allowed more governments to target people who are unhoused by criminalizing them. These examples of criminalization are representative of the broader movement. We've seen state and local governments across the political spectrum move to add or expand crimes, as well as ramp up enforcement of existing crimes. Mayors such as the mayors of Philadelphia and San Francisco have targeted encampments, destabilizing, traumatizing people, as well as undermining public health. And governors, such as the governors of California and New York, have looked to expand laws allowing for involuntary coercive treatment models like involuntary confinement as a way to address housing, mental health, and substance use disorder concerns. Next slide, please. Should be on policing and criminalization. I think it's the one before this. Thank you. So the Supreme Court has fanned the flame of policing, racist policing, through their quote shadow docket. They've allowed ICE agents to profile people based on the color of their skin, the language that they speak, or the job that they work. As a consequence, we've seen the administration take advantage by descending on cities, including LA, Chicago, Portland, to intimidate, terrorize, and criminalize Black and Brown communities. In Chicago, which is the recent phase of this attack, agents raided an entire building in the middle of the night using flashbang grenades and helicopters. They separated parents and children and zip-tied entire families. They've been patrolling the streets and harassing residents, and they fired on protesters with pepper balls and chemical weapons. They've further questioned the enforcement or the compliance with certain consent decrees, which are aimed at protecting the rights of people against violence, police violence, and discrimination. On the next slide, I have a quote from Interrupting Criminalization, which is a national capacity building organization, an abolitionist capacity building organization. And it really speaks to the way that these recent actions leverage criminalization to consolidate and exercise power to advance the administration's agenda. The process of criminalization is more than just criminal laws and policing, but it reflects and reinforces the idea of who is, quote, other and must be surveilled, controlled, and removed from society. And although incarceration is often viewed as the outcome of criminalization, the effects of criminalization extend far beyond that, as we know. People with criminal records face extreme challenges in accessing housing, employment, many other systems due to their conviction. So this administration has stripped certain communities, especially Black, Brown, LGBTQ, working class, and disabled communities, of resources and support, and at the same time push for systems that police and punish. This means that more and more people will be unable to access the care that they need, and more likely to be punished and isolated for their health, economic, or social condition through the carceral systems. These steps represent just a part of the process of gaining and maintaining power and advancing the right-wing fascist agenda. So what does this mean for people living with HIV? So amid these federal attacks, people living with HIV are already at an increased risk of criminal legal involvement due to the existence of HIV criminalization laws. Next slide, please. Many of these laws, like including the ones in Ohio, have existed for decades, but they are particularly relevant now as a threat to the safety and well-being of people living with HIV because of the expanding use of criminalization as a way to police and control. These laws are a current example of the process of criminalization, which labels people with stigmatized identities as worthy of that state interference, state violence. So with that in mind, it's important to understand some essential terms as we have defined it as CHLP. HIV criminalization refers to laws, policies, and practices that impose heightened criminal penalties on conduct of people living with HIV for conduct that is not criminalized or criminalized less severely for people not living with HIV. These increased penalties could manifest as distinct criminal offenses, such as exposure or transmission offenses, enhancements that increase the length of incarceration or fines, forced testing or treatment, or other severe penalties, such as registration on the sex offense registry and compliance with its extensive requirements. HIV crim could also occur through the use of general criminal laws, such as aggravated assault, which don't specifically mention HIV or another communicable disease. Case law has interpreted those laws as being applicable to the behaviors of people living with HIV. And we know that HIV crim is a product of inaccurate, stigmatized views based in queerphobia, white supremacy, and misogyny. And the laws emerge from those prejudiced ideals, as well as perpetuate those prejudiced ideals through the surveillance, control, and punishment of communities deeply impacted by HIV. On the next slide, I'll dive into another definition that we use, HIV specific. So these are a certain portion of HIV criminalization laws. A law is HIV specific when it solely names HIV or uses an expansive definition of, quote, communicable disease or some other similar term, which includes HIV because it imposes criminal penalties um, or heighten criminal penalties on the behavior of individual by singling out their health condition. Regardless of the exact language, regardless of the exact language used, the effect remains the same. Next slide, please. I want to highlight the difference between offense and enhancement, which is how we've divided up the HIV specific offenses. An offense is a law that imposes criminal punishment for engagement in certain behaviors. So in the context of HIV criminalization, offenses impose criminal punishment on people living with HIV for behavior that is not criminally punished for people not living with HIV. This behavior might be having sex or donating blood. An enhancement imposes heightened penalties on top of existing penalties. So for people living with HIV, these are increased penalties for engaging in already criminalized behavior, such as sex work or sharing drug use equipment. On the next slide, there are several different categories of offenses as we have defined them. Exposure, transmission, and non-disclosure offenses are often used interchangeably, but typically they're separate and distinct offenses, and you have to look at the statutory language to interpret which activity is precisely being criminalized. An exposure law imposes criminal penalties on people living with HIV for engaging in specific behaviors that purportedly create the possibility of HIV transmission, such as having sex or sharing syringes, or more broadly exposing another to HIV through any means or contact. This does not mean that there's an actual risk of transmission, but instead it focuses on the perceived risk of transmission. A transmission law imposes criminal penalties on the, quote, transmission of HIV. So transmission requires seroconversion, someone becoming positive. Non-disclosure laws are a bit different. While many states impose criminal penalties on exposure or transmission, some states focus on non-disclosure of status to sexual drug use or other partners. That is, these states criminalize distinct behavior. So Indiana has a duty-informed law, and people who do not fulfill this duty are punished through their failure to comply law. The next slide describes some of the different characteristics of many HIV criminalization laws. A lot of them do not require transmission at all. So any kind of activity viewed as sex or allegations of non-disclosure are enough for prosecution under the statute that describes, quote, exposure or uses similar language. These laws also don't really consider the risk of transmission. Risk reduction measures are not a defense to prosecution, such as condom use or low viral load to treatment. Those types of considerations are not really taken into account. Negligible or zero risk activities such as oral sex and spitting are often criminalized within many laws. And intent to harm rarely is considered or required. That means the person does not have to have the specific intent to expose someone to transmit HIV or to have the intent to transmit HIV to another person. Proof of disclosure is often the only defense, as in Ohio. We know from personal stories, news coverage, and case law that disclosure is often exceedingly difficult to prove and requires very creative methods of disclosure. These laws often impose severe and disproportionate punishment. So felony punishment is very common, even when no harm occurred. And sex offense registration occurs in 5 states, including Ohio. Before I provide our maps that describe a national landscape, I'll just offer an overview of some of the laws in Ohio on the next slide. There are 6 HIV-specific laws in Ohio, the most of any state. 3 impose criminal penalties on people living with HIV and engaging in some aspect of sex work. 1 targets people living with HIV and being detained in a carceral facility. That's an enhancement. and one imposes criminal penalties for having sex without disclosure of one's status, as folks in the chat have pointed out. That is very closely related to a disclosure law. There's also another offense that criminalizes blood product donation or sale by people living with HIV in Ohio. As stated earlier, though, prosecutions, of course, still occur through the use of general criminal laws that don't mention HIV at all. And HIV test results can be disclosed involuntarily to aid in certain criminal proceedings. Those are just different forms of HIV crim within Ohio. On the next slide, we'll dive into some of the maps that break down the offenses and enhancements. I'll start with the offenses map. There are 32 states with an HIV-specific exposure, transmission, or non-disclosure offense. That is, 32 states have laws that directly or indirectly single out the behavior of people living with HIV for criminal punishment. On the right, there's the HIV specificity scale, which is broken down into 4 categories. 12 states have offenses in which HIV is specifically named in the offense and no other disease is listed. 4 states have offenses in which HIV is specifically named alongside other diseases. 7 states have offenses that use the term communicable disease or something similar. And the law in those states clearly considers HIV one of those, quote, communicable diseases. And finally, 9 states use the term, quote, communicable disease, and the statutory, administrative, or case law definition of communicable disease is likely broad enough to include HIV. Geographically, although concentrated a bit in the South, we see that these offenses exist all throughout the United States. Many of the most specific laws, the laws that specifically and only name HIV as a criminalized condition, are present in the South, but there are other examples in the Midwest, such as Ohio and Northwest. Ohio has that HIV-specific exposure non-disclosure offense that uses the most precise language to target people living with HIV. The statute doesn't require HIV transmission, doesn't require an intent to cause HIV transmission, nor does it require engagement in behavior that actually poses a risk of transmission. Anyone convicted under the law in Ohio is required to register on the sex offense registry because the way sex offense has been defined as a registrable offense, it includes anything with a sexual motivation, and that applies to the HIV-specific law, basically all instances of it. On the next slide, you'll see our newer map, which is our donation offense map. These offenses impose criminal penalties for the attempt to donate or sell, or the actual donation or sale of blood products, semen, tissue, organs, or other bodily fluids. It's important to note that although federal rules surrounding donation of organs by people living with HIV have changed in recent years, there's still a federal offense criminalizing the donation or attempted donation of blood products or organs by people living with HIV. So across all of these states, there is the federal threat. In addition to that federal offense, though, there are 14 states that criminalize donations. These offenses are concentrated in the South and Midwest and mainly use that highest level of specificity. As mentioned, Ohio has a donation offense that makes it a felony to donate or sell blood while living with HIV. The next slide covers sex work enhancements. Almost every state, including Ohio, criminalizes sex work or some aspects of sex work through misdemeanor punishment, largely. Sex work enhancements impose additional punishment, usually a felony level punishment on people living with HIV for engaging in the same behavior. 10 states, largely in the South and the Midwest, have penalty enhancements for sex work. And all of these states use the highest level of specificity to target sex workers. Ohio has 3 distinct sex work enhancements. One criminalizes actually engaging in sex. Another criminalizes solicitation or asking someone to have sex. And the third criminalizes loitering to engage in sex, which is basically existing in certain spaces and living with HIV. In other words, the enhancements criminalize using felony level punishment on top of existing punishment, behaviors that pose absolutely no risk of HIV transmission, like talking about sex or walking down the street. The next slide covers the bodily fluid enhancements. It's already a crime to expose someone to a bodily fluid. In most states, this is considered an assault or a battery, but bodily fluid enhancements impose additional criminal penalties on people living with HIV for, quote, throwing, quote, striking, or otherwise causing someone else to come in contact with their bodily fluids. So similar to sex work enhancement, many of these enhancements are concentrated in the South, but these bodily fluid enhancements commonly criminalize people living with other stigmatized health conditions, such as viral hepatitis or tuberculosis. Ohio has a bodily fluid enhancement that increases the length of incarceration and fines for people who are convicted of making a law enforcement officer come into contact with their bodily fluids. On the next slide, I'll just plug our maps for folks to check out. We have a QR code that could be useful for y'all. If that doesn't work for you, if you check out our website, hivlawandpolicy.org, our maps are very helpful and might provide some information to you if you're coming from a different state too. Next slide, please. I want to talk about some of the harms of HIV criminalization. The slides will be available. Happy to provide those. Please feel free to reach out, though, if you have any additional questions. These harms of HIV criminalization really speak to generally the harms of criminalization across the board, especially within this resurgence of criminalization. So to be clear, there's no evidence that these laws improve public health. There's no evidence, in other words, that these laws deter behaviors that are more likely to result in transmission, that they promote disclosure, or that they reduce the number of diagnoses overall. However, there's growing and broad evidence that these laws harm our communities. I'll highlight these harms and then provide a little bit more detail on some of the public health harms in a moment. These laws exacerbate stigma against HIV and people deeply impacted by HIV. We know that HIV stigma remains a huge problem, threatening the health and safety of people living with HIV, but this also plays into the public health harms that I'll talk about later. Moreover, these laws worsen barriers to HIV prevention, testing, and treatment. For example, many of the laws only apply to people who are aware of their status. So that creates a clear disincentive to getting tested, becoming aware, becoming empowered about your health, and getting the treatment that you need. They also disrupt care by increasing criminal legal involvement, making it less likely that people will be able to access their medications or engage with the provider that they prefer. These laws also perpetuate one-sided messaging about sexual health prevention and responsibility. It's not solely the responsibility of people living with HIV to engage in conversations about HIV or other STIs, but rather these should be open communications between consenting adults. These laws also disproportionately harm marginalized communities. I will highlight just one aspect of that in a moment. These laws are driven by misogyny, white supremacy, and queerphobia, and the enforcement data really bears this out. Lastly, the laws undermine care and support for people living with HIV and other disabilities by reinforcing ableist systems that criminalize health conditions. HIV crim laws are ableist because they single out people based on their health status, and instead of focusing on real public health solutions, the laws criminalize the mere fact of having HIV, undermining the rights of people who are disabled. This feeds into narratives about using punitive approaches instead of human-centered autonomy and care. On the next slide, you'll see a graph from the Williams Institute at the UCLA School of Law, which is particularly helpful. They do a ton of research into enforcement of HIV criminalization laws. We know that HIV disproportionately impacts Black, Brown, and LGBTQ communities due to systemic failures within our societal structures. So, institutional racism, racialized medical mistrust, unstable housing, and inadequate healthcare access really force Black, Brown, and LGBTQ communities to be more vulnerable to HIV and at greater risk of acquiring HIV and being unable to properly manage the condition. In Ohio, there's a higher incidence among Black and Brown Ohioans, and as well as lower viral suppression. What HIV criminalization does is criminalize the result of these systemic failures. So as a consequence, HIV crim disproportionately affects underserved and marginalized communities. For example, although Black folks represent 13% of the population in Ohio, they represent 44% of the people living with HIV and 46% of the people arrested for an HIV criminalization offense. The next slide talks about stigma, which is a huge barrier. Stigma against people living with HIV, especially stigma against people in the communities who are disproportionately impacted by HIV, is very common and intense, and it intersects with other forms of stigma, anti-Black stigma, anti-disability stigma. The criminal law, though, as I mentioned earlier, represents like a codification of these stigmas. HIV crim is just one facet of a scheme of criminalizing, stigmatizing, and otherizing people living with and deeply impacted by HIV. And this structural stigma is very powerful when it comes to HIV care. So fears of social, economic, and other consequences push people away from seeking out care, seeking out testing, seeking out services, as well as just generally discussing their status with partners or continuing to engage in care. And this negatively impacts the health of individuals as well as undermines public health. I want to highlight just some of the public health consequences of HIV crim. The next slide talks about HIV criminalization and its association with public health concerns like reduced PrEP uptake. Researchers have looked at the associations between PrEP need, something formulated as PrEP to need ratio, and HIV criminalization laws. The analysis has found that PrEP to need ratio was negatively associated with HIV criminalization laws. So in other words, in states with HIV-specific criminalization laws, there was reduced utilization of PrEP relative to HIV incidence compared to states without HIV-specific laws. So this finding suggests that HIV crim laws may have, as the authors put it, a chilling effect on PrEP uptake because of the role of stigma in discouraging people from accessing care and starting PrEP. Another aspect of the public health harms is HIV testing. There's also research done by the CDC comparing laws in California with Nevada. So in 2018, California added more elements to its HIV-specific law, including the requirement of an intent to cause harm, actual transmission, and engagement behavior that poses substantial risk of transmission. They also repealed their HIV-specific sex work enhancement. And the research looked at whether the California reforms were associated with higher past year HIV testing compared to Nevada, which did not reform its HIV criminalization law. HIV criminalization reform was associated with an increased likelihood of past year HIV testing. The researchers concluded by noting the potential broad criminalization and inflaming stigma and creating a clear disincentive to getting tested. So I have a quote here, quote, "State HIV criminalization laws are a structural barrier to HIV testing as they may increase stigma, exacerbate disparities, and potentially discourage individuals from testing to avoid knowing their HIV status," end quote. With that in mind, the next slide just highlights some of the organizations that have come out against HIV criminalization. These public health organizations, medical societies, and legal professional organizations have called for reform or repeal to existing laws, as well as urged states not to consider additional laws. Many of these states have signed on to our consensus statement that we facilitate that speaks to some of the reforms that could be made to make these laws less expansive and less harmful. So at the same time, I want to leave y'all on some less depressing and potentially more positive outcomes within recent months, even within this administration. These have all been made in the anti-criminalization work for HIV. The biggest milestone we saw was the full repeal of 2 HIV-specific statutes in Maryland and North Dakota. While there are HIV crim statutes that are still on the books underneath these laws, these actions represent a lot of hard work and organizing from people living with HIV and advocates in these states. The political diversity of the states also speaks to the possibilities within challenging environments, such as conservative states. We also worked with the Louisiana Coalition on Criminalization and Health to defeat a bill that would have added an entirely new offense criminalizing people living with an STI in Louisiana. Those advocacy efforts focused on elevating the experiences of Black women who are living with HIV and have survived sexual assault. Advocates worked to explain those particularized harms on survivors of sexual violence and pushed for evidence-based alternatives to criminalization, so expanded testing and improved access to post-exposure prophylaxis for survivors. That resulted in the bill being pulled, and instead a task force being created to examine effective public health solutions to ongoing HIV criminalization, or excuse me, HIV and STI epidemics. And one of those possibilities that has come up is reform to the existing HIV criminalization offense in Louisiana. Amid the federal onslaught to prevention and treatment efforts, we've also seen coalitions push for more expansive change to deliver justice for people living with HIV, as well as promote public health. For example, advocates in Wisconsin and Arkansas, alongside efforts to reform HIV crim laws, have pushed for broader access to prevention methods like PrEP, so expanding PrEP access within pharmacies, reducing insurance barriers, have also been paired alongside decrim. And finally, on the next slide, I want to just emphasize some key takeaways. What are things that we should be thinking about within this moment? How can we best respond to it? While we see a resurgence in punishment and carceral tactics, it's important to remain focused on, alongside, resistance, addressing HIV crim, which remains a huge threat to people living with HIV. These laws provide another tool for authoritarian control and must be removed or at least restricted to limit the harm against people living with HIV. Criminalization, of course, does not include public health. Rather, it jeopardizes health of individuals and it undermines public health by creating substantial barriers to treatment and prevention program. The harms caused by HIV crim really speaks to these effects. And in our response to this moment, we have to remain focused on communities most impacted by these systemic issues and most vulnerable to criminalization and other punitive responses that are implemented in response to these issues. We cannot sacrifice any communities in the hopes of placating this administration. That means standing alongside Black and brown trans people and migrant communities who have been predominantly targeted by this administration and never abandoning them for the sake of expediency or perceived safety. We have to build coalitions that bring diverse people and advance intersectional justice focused on people most impacted, including, in Ohio, the Ohio Health Modernization Movement, On the next slide, I'll just again plug the Positive Justice Project, which is our national campaign. Please feel free to scan that QR code. You can also find more information about the Ohio Health Modernization Movement online. I'm happy to answer any questions that folks have. Thank you very much.
Thank you, Sean. Apologies to everybody for the view and how it was kind of annoying. We will get that fixed going in the future. I wonder, Sean, if you can talk about some of the efforts around in Louisiana, because we're seeing some efforts like that happen in Ohio where they're looking at trying to criminalize other sexually transmitted infections. So could you talk a little bit more detail about their experience?
Definitely. I'm happy to highlight the Louisiana experience because it's a recent one, and it also speaks to the mobilization of advocates within the state. There have been several significant and sensationalized reports about HIV and other STI exposures within the state. And those have kind of mobilized legislators in a way where they are looking to double down on their carceral tactics. Louisiana has some of the highest rates of incarceration. They've also has some of the most severe disparities within enforcement, specifically for their HIV criminalization statute. The vast majority of the folks who have been arrested and prosecuted within the state are Black and brown people. So many legislators have really used those sensationalized news reports to advance these bills. But what the coalition did in response was really kind of inspiring and speaks to the commitment to developing effective solutions that don't punish the very communities that they're trying to help. So specifically, we worked with survivors of sexual violence who speak to their own experience being in relationships with abusers. HIV criminalization laws have a really perverse and destructive effect within abusive relationships. There's always the ongoing threat that an abuser would use the criminal law to coerce and control people. So using the threat that they'll go to police. So if someone's living, if a survivor is living with HIV or another STI, they always have the threat of criminalization because abusers may use the threat that they'll go to the police and allege that someone didn't disclose their status prior to engaging in sex. And that has been used to keep people within really violent and horrific situations. There's also the possibility that even after a relationship ends and a survivor is able to get out of a relationship, there's always the possibility that someone could be charged under the law after the fact. Someone living with HIV could be further victimized by the abuser who uses the law to prosecute and cause harm. We took the experiences and really centered those within our advocacy efforts, wanting legislators to understand that it's not as simple as, a person living with HIV and a person not living with HIV, and always the person living with HIV is some sort of villain. No, those are just destructive narratives that are based in stigma. We want to develop, effective solutions that don't just punish and harm communities they're aiming to help. So we pushed for expanded testing. We're looking at better comprehensive sex education within Louisiana. And these are solutions that I think, most legislators can get behind instead of just reinvesting in the criminal legal system in a way that causes further harm.
Thank you, Sean. I got a couple of questions in the Q&A. The first one says, what is the best place to find the most recent and most accurate up-to-date around these potential law changes? Would that be maybe your website?
Yeah, and potential law changes. I'm just curious about that. I would definitely generally refer y'all to our website. If you're interested in learning, having a very detailed analysis of the laws within your state, check out our source book. I can drop that in the chat. Our source book is like our Bible, as we call it. It compiles HIV criminalization laws across the United States. Very detailed analysis that might be not helpful at times. So I often point people also to our maps, which I've just tagged here. Our maps, which provide, a graphic representation. I think they're very easy on the go for you to just get a grasp of what it looks like in your state as well as across the country. And that might be very helpful within advocacy situations when you're trying to educate people who are not familiar. The last thing that I plug to is our timeline of reforms. This speaks to the possibilities outside of, ongoing criminalization. What have states been doing? It might be particularly helpful to highlight, the diverse variety of states that have reformed or repealed their laws in recent years. As I mentioned, North Dakota became the fourth state to repeal their HIV specific offense. Now, they also have another law that's on the books, but the emphasis on repealing a discriminatory law was very effective within the state. I see that there's another question.
Yep.
Yeah, from Julie. Could you please speak on to how and if U equals U has been used to help in efforts to change or eliminate these laws? I'm happy to explain some of the tension within using U equals U, as well as just emphasize again, the timeline of maps talks about some of the reforms that have been made, and it does highlight the states that have used U equals U and institutionalize it, formalize it within their laws. That was common maybe about 5 to 10 years ago, adding reform that incorporated persons' undetectable viral load as a defense. I'd say the trouble with that is creating, as some folks call it, a viral underclass. And that's where people who have been unable to access healthcare and public health systems, it's well documented, are not able to maintain an undetectable viral load. And it just allows a crack or some sort of gap for those folks to be continue to be prosecuted within these laws. When in reality, we know that many of our systems are not designed for people who may be experiencing houselessness or folks who may not be able to access their medication while they're incarcerated. Those sorts of barriers to care would still exist and could create the possibility of allowing for criminalization of folks who are the most marginalized from our systems.
Thank you for going into that. I have a question actually, because I was very surprised to learn that South Dakota has made some changes, and they sound like some pretty good ones. And it sounds like they hit a pretty unique situation there. Could you talk about kind of how that happened?
Yeah, advocates in North Dakota recently repealed the specific exposure law. This was a law that broadly criminalized people living with HIV. They also criminalized, syringe sharing, so they had an enhancement too. And there were none of the evidence-based elements within the law. So there was no consideration of whether HIV was transmitted, or if there was an intent to harm, or there was actual engagement in behavior that posed a risk. That law was on the books. And what advocates did in this state was they used the timeline. This is evident within testimony within the legislature. They emphasized that states have reformed in recent years. Some states have even repealed in recent years. And what the statutory scheme that they had this law on the books that was specifically imposing all of these requirements on people living with HIV and criminalizing and punish very severely if they did break that law, at the same time as they had a separate public health law that still criminalizes people living with any communicable disease who act in a willful manner to expose people, something along those lines. So what advocates did was emphasize that there's no need to have this blatantly discriminatory law that singles out a specific condition. And that was very effective in assuring legislators that there is this other law that could be used to prosecute, quote, boogeymen or whatever they want to describe it as. On our end, we are not eager to point to these other laws that can be used to criminalize people living with HIV. And we want to be clear that this is still a threat to the health and safety of individuals and undermines public health and is counterproductive. So although there was repeal, we are still going to be pushing for a full repeal. And, that's a recognition that carceral punitive public health that punishes people based on their health condition is ineffective, and we should get rid of all of those laws.
Thank you for that, Sean, and clearing that up, especially since it was North Dakota, not South Dakota. All right, everybody, thank you so much. Sean, this was great. Thank you so much for joining us today. We're really excited for the week-long educational event we've got here. For those attending, if you're seeking continuing education credits, the link is in the chat. And when you exit the room, it should also pop up for you. That needs to be completed by the end of the day today to receive those credits. And you need to be in the room for at least 60 minutes, according to the Ohio board. So again, everybody, thank you for joining us. A big thank you to Sean for going through this with us. And I think this will set the tone for the week. So everybody have a great afternoon. And go ahead, Sean, you came off mute. Sorry.
I'm sorry. I just see that in the chat, they weren't able to get the links that I had dropped. Thank you. Okay. Thank you. Someone had just shared it. But a lot of these resources are on the website. I'd encourage folks to go on to hivlawandpolicy.org and search for maps or timeline, and those will pop up. Thank you.
Have a good rest of your day, everybody. And thank you so much.